I'm a surgeon, right? I'm going to operate. I'm going to do all the ACLs and all the rotator cuffs and all the UCLs and all of those things because that's who I am. This platelet-rich plasma stuff, that's for the birds. And so this guy comes in, can't do his marathons. He has Achilles tendonitis. He's seen all the people in town. He comes to me, hey, what can you do? And so as I'm walking out the door, I say to him, well, there's this thing called PRP, platelet-rich plasma. We could potentially do that for you. He's like, sure, sign me up. And there's a lot of things that we've done that just don't work or quit working after time. And there's some craziness, right? Anybody use steroids in knees today? Yeah, steroids are absolutely terrible. Terrible, terrible, terrible. I think that if we're thinking about medicine and protecting people and taking care of people in the proper way, those are the things that we probably should let go of over time. So here's the basics of things: regenerative medicine, stem cells and growth factors. That's essentially it. And as Dr. Parita talked about a little bit, there is the stem cell, but it's really what the stem cell does, right? When I started all this game, it was about the stem cell. I actually had no idea what it did other than it's some magical cell that does this thing. But it really has a way in which it works, right? Immunomodulatory, so T cells, which was mentioned earlier, dendritic cells, monocytes. So it's not just the stem cell itself, right? One of the things that I hate to see is you're just putting it in and doing things without knowing why we're doing it, how it works. I think that's just not good medicine, right? To do it in that way. As I've gone along in this, I understand more of saying, oh, how do you do this and why do you do it in this way? Because that matters and what we're really after. That stem cell is great, but it's really that exosome is the business end of those things, right? That's really how these things go about. Several years ago, I think it was maybe 2016, 17, whenever they, wasn't their last championship they won, but the championship before that, before they got KD. But he had a MCL sprain, grade 3, treated with PRP and back within 2 weeks, playing at a high level. So this stuff works, right? And you need to see what's causing the problem. More than likely, it's not structural. More than likely, it's inflammation that's causing the issue. And when you inject these things, stem cells from bone marrow, stem cells from adipose, stem cells from off the shelf, or even growth factors, or any of those things, it now changes the environment that's there. I like to think about it as a swamp that you're now going to turn into a garden, right? So you take that swamp, you clean it up. It still has all the craziness in there, the cracks and the breaks and all that stuff. But now the environment is different. And so now you don't have that pain that you had before, and that's what you're really after. It's not really the structural model that we're trying to get after. There's sometimes you shouldn't treat them. You have to understand, like, okay, you're not going to get better. And you have to be able to say, okay, you are not the right patient. You don't give them hope in the way that's not realistic. And you always be super, super honest with them. This may get you where you want to go, it may not. I've seen some pretty amazing things with what I've done. But the one thing that patients know about me is that, listen, I'm not going to sell you some dreams if I don't think it's going to help. And there's definitely times when I've told patients, like, no, I will not do this on you. And if you think about the relationship that you have as a physician with the hospital, right? They're telling you how to practice, but they're making all the money. Same thing like with this. And that's another thing that we have to wake up to as far as being healthcare providers, is that we have to take back what belongs to us. If we're gonna take the risk, we should make all the money. And that's not saying that we're about money, we're just saying we're just gonna make it equal. One of the things that we don't do enough of is get together, talk about those things, and unite in that way. We're usually off in our little silo because that's how we've been trained to do. It's very interesting how they keep us segregated. That's why I love talking to guys like Dr. Ronalds, because he gets out there in the middle and he talks about these things. Hey, we need to be more together.